Hi everybody, welcome to another episode with the Anxious Resistance. Today I'm going to be talking about a medication called Baclofen and its potential use in the treatment of anxiety disorder. Baclofen is a muscle relaxant and antispastic medication. It is used to treat muscle symptoms caused by conditions like multiple sclerosis, including muscle spasms, pain, and stiffness. Now, we'll get into a little bit more about how it's used for anxiety after a brief overview. Baclofen works by blocking certain signals in the brain and spinal cord that cause muscle spasms and cramping. This blocking effect reduces contractions of the muscles, allowing them to relax. Baclofen comes in tablet form and can be taken by mouth. It is sometimes also administered intrathecally, meaning it is injected into the spinal canal so it can directly target receptors in the spinal cord. The effects of Baclofen help muscles relax, which can provide relief to patients suffering from uncomfortable muscle tightness, spasms, pain, and loss of muscle control. When delivered directly to the spinal cord area, lower doses can be used. So a little about the background of Baclofen. It was first synthesized in 1962 by Dr. Heinrich Kaberle, a chemist working for the Swiss pharmaceutical company Ciba Gigi, if I'm saying that right. Kaberle was searching for a drug with muscle relaxant properties that could potentially treat spasticity and pain associated with multiple sclerosis and spinal cord injuries. After synthesizing the compound, Dr. Kaberle extensively tested Baclofen in animal models and found that it had potent muscle relaxant effects without sedative side effects. This made it distinct from other muscle relaxants available at the time. So Baclofen was patented in 1962 and approved in Switzerland in 1967 for treating spasticity under the brand name Lioresal. It was eventually approved in numerous other countries, including the United States in 1977. Today, Baclofen remains a widely used medication for spasticity, and it has also found off-label use for treating alcoholism and anxiety disorders. Okay, so how exactly does Baclofen work? It works as a muscle relaxant by activating the GABA B receptors in the brain and spinal cord. Many of you out there in the audience are probably already familiar with GABA because so many psychiatric medications work on GABA. That includes benzodiazepines, multiple mood stabilizers, Lyrica, gabapentin, all of these medications that we use to treat certain mental health disorders work on GABA. So GABA, which stands for gamma amino acid, is an inhibitory neurotransmitter that reduces excitability and suppresses neurotransmission in the central nervous system. When Baclofen binds to GABA B receptors, it inhibits the release of two excitatory neurotransmitters, glutamate and substance P glutamate, which are involved in anxiety, stress, and restlessness. Substance P also exacerbates anxiety and stress responses. By suppressing glutamate and substance P, Baclofen helps induce muscle relaxation and reduce nerve pain signals. This GABAergic activity of Baclofen helps minimize anxiety, relax muscles, relieve muscle spasms, and prevent pain signal transmission. So again, we kind of see some relation between the Baclofen and other medications that we already use, like Lyrica and gabapentin, that can be used for pain, but we also have very, very strong evidence that gabapentin and Lyrica work for anxiety disorders as well. In fact, I see gabapentin given constantly for anxiety disorders in a clinical setting. So at high doses, Baclofen may also weakly inhibit the uptake of dopamine and norepinephrine. This can aid its anti-anxiety and muscle relaxant effects. However, Baclofen's primary mechanism of action is activation of GABA B receptors and suppression of glutamate, which is an excitatory neurotransmitter, and substance P. So what evidence is there out there specifically that Baclofen can be used for anxiety? Baclofen has been studied in a few trials for anxiety disorders with promising results. A double-blind, placebo-controlled study of 22 patients with anxiety found that baclofen significantly reduced anxiety scores compared to placebo after 4 weeks of treatment. Patients received up to 80 milligrams per day of baclofen. Another randomized controlled trial looked at baclofen for social anxiety disorder in 30 patients. The baclofen group had significant decreases in anxiety levels and was well tolerated over 12 weeks of treatment. Dosage ranged from 30 to 80 milligrams daily. An open-label study followed 15 patients with a panic disorder treated with baclofen for 3 months. At the end of the study, 73% of patients experienced a reduction in full panic attacks. The average dose used was 48 milligrams of baclofen per day. Finally, a retrospective study reviewed 18 patients with refractory generalized anxiety disorder, so refractory meaning resistant to treatment, who received this adjunctive baclofen. So baclofen is a stopgap treatment, more or less. 39% of patients had a significant response to baclofen based on clinical global impression scores. The maximum dosage used was 120 milligrams daily. Overall, several controlled trials and open-label studies provide evidence for baclofen's efficacy in reducing anxiety for disorders like social anxiety, panic disorder, and generalized anxiety disorder. Larger scale, longer term studies are still needed, but the current data looks promising for baclofen's use for anxiety. Okay, so a little bit about why we care. What are the benefits of baclofen versus current anti-anxiety medicines, besides it just being another option for those who fail treatments with other medications? So baclofen has some advantages over other common medications used to treat anxiety, like SSRIs and benzodiazepines. Compared to SSRIs like Zoloft, Lexapro, and Prozac, baclofen works much faster. And we know how important faster is. We don't want to be waiting weeks or even months in order to see some improvement or to even know if the medication is going to work for us at all. So patients usually see improvement in anxiety within 1 to 2 weeks rather than the 4 to 6 weeks with SSRIs. This makes baclofen preferable for those looking for quick relief. And unlike benzodiazepines like Xanax, Klonopin, and Valium, baclofen is not habit-forming and has a much lower addiction and abuse potential. This makes it safer for long-term use. Baclofen does not cause sexual side effects like SSRIs often do. This makes it an option for those who cannot tolerate SSRI sexual side effects. We also know how important that one is. Baclofen is sedating and a muscle relaxant, making it helpful for those with anxiety accompanied by muscle tension, which is many people. Restlessness and sleep disorders can also be treated using baclofen. SSRIs and benzodiazepines are less effective for these symptoms. So, some evidence shows that baclofen enhances the effects of benzodiazepines, allowing lower doses of benzos to be used. This reduces risks of benzo dependence. For anxiety accompanied by alcohol dependence, baclofen may be preferable to SSRIs and benzodiazepines since it treats both conditions. SSRIs and benzos do not reduce alcohol cravings and intake. So in patients willing to try a non-traditional anxiety medication, baclofen offers advantages over first-line options like SSRIs and benzodiazepines in terms of quick relief, reduced addiction potential, lack of sexual side effects, and benefits for comorbid muscle tension and alcoholism. More research is still needed, though, to fully compare the effectiveness. So I think that baclofen just needs to catch on a little bit in off-label treatment. And once doctors, providers, prescribers see that it is working and the patients are experiencing the benefits from it, then it will catch on, become more popular, and used broadly. Sometimes the studies follow after things catch on, popularity-wise. I think that was true of something like gabapentin, and I think it also was true of something like ketamine. People found out in the world that it was doing a good job and it was effective, and so the studies followed afterward, and then they got the scientific evidence afterward. So sometimes that's what needs to happen, and where baclofen is a fairly safe medication, I think it should start being used more often, especially because of these advantages that it has over benzodiazepines and SSRIs in the treatment of anxiety. Okay, so let's talk a little bit about how baclofen is dosed. So baclofen used for anxiety is started at a low dose of usually 5 to 10 milligrams taken 3 times per day. The dose may be gradually increased by 5 to 10 milligrams every 3 to 7 days to a maximum dose of 20 to 80 milligrams per day, divided into 3 doses. Baclofen should be taken with food to help prevent stomach upset. It is important not to stop baclofen suddenly, as this can cause withdrawal symptoms. Your doctor will instruct you on how to properly taper the medication if discontinuing. So a little bit similarly to benzodiazepines, you can have some kind of dependence with baclofen. Now, it has a very low potential for abuse. It is not a controlled substance, so it's really not going to be a big deal, but you are likely going to need to taper off, and that's true of antidepressants anyway, and that will definitely be true if you're taking benzodiazepines for a long term. So that's not a significant disadvantage for baclofen, because you're already going to be doing that. So the dosing schedule can vary based on individual factors. Always follow your doctor's specific dosing recommendations. Taking baclofen at evenly spaced intervals throughout the day is generally recommended to maintain stable blood levels, and you are dosing it 3 times a day, which is a bit of a disadvantage, but with something like gabapentin, you're already doing that. So what are some of the side effects and risks of taking baclofen? Like most medications, it does have potential side effects and risks. Some of the side effects include drowsiness, dizziness, weakness, fatigue, nausea, vomiting, headache, insomnia, tremors. And some of the less common but more serious side effects include mood changes, confusion, depression, breathing problems, irregular heartbeat, and seizures. Now, don't let that dissuade you, because all psychiatric medications have some scary sounding side effects. So baclofen should not be used by people with certain pre-existing condition or risk factors. Contraindications and precautions include people with impaired kidney function, impaired liver function, history of drug or alcohol abuse. So that just means that, when prescribed, there's a higher risk of abuse for the baclofen. Coronary artery disease, epilepsy, and pregnancy. Its safety in pregnancy has not been established yet, so it is not recommended to take during pregnancy. Baclofen should be used with caution in elderly patients due to increased risk of confusion and seizures. It's important to monitor patients closely and report any worrisome side effects to a doctor right away. Starting at a low dose and slowly increasing can help minimize adverse reactions, and that's true of just about every single medication I can think of. Start low and go slow. The benefits and potential upsides of baclofen for anxiety include: it is effective for anxiety relief. It does have muscle relaxant properties, which are an additional benefit. It does have fewer dependency issues. It does not have the dependency issues of benzodiazepines. Again, it is not a controlled substance. It may help with sleep. I don't know about you guys, but I've had some of the best sleep of my life after I've taken a muscle relaxer like cyclobenzaprine, also known by its brand name of Flexeril. So I imagine that taking baclofen can really help you get some good sleep, especially if you have a lot of muscle tension problems. So there is also some evidence that it may enhance mood and not just cause calm. There is some early research that baclofen might have antidepressant effects and elevate mood in those with mood disorders, in addition to anxiety. However, more studies are still needed on this potential benefit, so take that one with a grain of salt, but there is a possibility that it may help you with your mood. So it may help with alcohol addiction. Baclofen has shown promise in reducing alcohol cravings and supporting alcohol abstinence. This could be an added benefit for patients with co-occurring alcohol dependence. It has a different mechanism of action, is a benefit. So it is totally different than the medications that we're using. I mean, it does have some similarities, but it is a different mechanism. And Baclofen is relatively safe. At prescribed doses, Baclofen is considered relatively safe and unlikely to cause harm, making it a reasonable medication to trial. However, side effects are still possible, as with any medication. In summary, the potential upsides of Baclofen are its efficacy for anxiety, meaning its effectiveness, muscle relaxing qualities, low risk of dependence, and unique mechanism of action compared to other agents. For some patients, it can represent a safer and viable pharmacological treatment option. So what are some downsides to Baclofen? Everything has some downsides. It can cause drowsiness and fatigue. The side effects is more likely at higher doses. Patients taking Baclofen should not drive or operate heavy machinery until they know how the medication is going to affect them. Baclofen may impair memory and concentration. This can interfere with work, school, or other daily activities that require mental focus. It has the potential for abuse and dependence. Patients with a history of substance abuse may be more likely to misuse Baclofen, so it does need to be supervised. Withdrawal symptoms can occur if Baclofen is stopped suddenly. This is why it's important to taper the medication slowly under medical supervision. Withdrawal may cause anxiety, insomnia, muscle spasms, and other unpleasant effects. Baclofen can interact with certain other medications and health conditions. Patients should be sure their doctor is aware of all medications and diagnoses before starting Baclofen. It may not be suitable for elderly patients due to increased risks like confusion or unsteadiness, which could lead to falls. Lower doses are often needed in seniors. Some people may experience depressive symptoms or suicidal thoughts. Patients should be monitored closely and report any changes in mood or behavior. Again, we've talked about some of the possible side effects. Baclofen is only available through prescription. It is not over the counter, and it is not an unregulated supplement either. It is by prescription only. It is not recommended in pregnancy. And then for some people, Baclofen simply may not provide adequate anxiety relief despite trying an optimal dosage and length of treatment. This is true of any medication. It's possible that in combination with other medications, you can achieve overall symptom relief from your anxiety. Again, discuss it with your doctor, see what other medications may be compatible if you're not getting significant enough relief from Baclofen. So Baclofen has risks and limitations that each person needs to consider carefully. Patients should have realistic expectations about potential benefits and weigh those against possible downsides. Close communication with one's doctor or prescriber is key. In conclusion, Baclofen is a medication that was originally developed for the treatment of muscle spasms, but has shown promise for the treatment of anxiety in some small studies. It works by activating GABA receptors in the brain, which reduces brain activity. Some potential benefits of Baclofen for anxiety include its fast onset of action and relatively mild side effects compared to other anxiety medications. However, the evidence is still quite limited and more research is needed. If you are considering Baclofen, be sure to discuss the potential risks and benefits with your doctor. Only use under medical supervision and at the lowest effective dose. While it may help some people, Baclofen is not yet a well-established anxiety treatment and has some drawbacks, like the need for frequent dosing, 3 times a day, and possible withdrawal symptoms. More studies are needed to confirm its overall effectiveness and safety in the treatment of anxiety. For now, it should not replace traditional first-line anxiety medications without careful consideration. Work closely with your knowledgeable medical provider to determine if Baclofen is appropriate for your individual situation. Thank you guys so much for watching this video. I hope you learned something. I find Baclofen a very interesting treatment for anxiety, and I think it holds a lot of potential. So I really want to hear if there's any of you out there who have taken Baclofen, if you've noticed any difference in your anxiety. Tell me about your experience in the comments, and I will get back to you. I get back to just about every comment on my channel. Thank you guys so much for watching. Also comment if there's anything else you want me to talk about or do a video on. I love suggestions, and I've been hearing a lot of really good ones lately. Thank you guys so much for watching. This is the Anxious Resistance, and I'll see you next time.